permissive way, and authoritarian no. So we should all aim at the authoritative kind of parenting, which is a balanced one, where the parents are both responsive and demanding as well. Thank you very much, Dr. Ruth. Now, I want to ask another question. I'm asking a question because this is what a lot of people ask around. Now, for ADHD, do children grow out of it? ADHD, autism, do they grow out of it? Dyslexia, do they grow out of it? Sometimes, do they?
Okay, good question. So remember the use of the term neurodevelopmental. That means that things are progressing and not static. So these conditions you've mentioned are all neurodevelopmental. Like I said, it starts right from even conception, and then it continues and develops. So as the child is developing, if they had a challenge and we're able to institute certain management and techniques, they can improve and improve and improve. And then one challenge may drop to the next, to the next, to the next. So you can actually come to the point where you may have not much challenges to worry about. It doesn't remove the fact that, say, the child has grown out of the autism, because sometimes there may be a few traits that may still be there, especially with how they are socially, responsive to people around. You may just have the traits. It's interesting how it's known that certain renowned scientists who brought very great discoveries were autistic, but probably the challenges they had as children, as they grew, and then, well, most of the time, common behavior of adults as autistic is probably not to be as sociable. So, fine. So it doesn't mean that at that point they are, or it doesn't mean that at that point the person is no longer having autism. They are having it, but then they are not of, there's no problem or challenge to be considered or to worry about at the moment. Now, other things like ADHD, yes, it's the same principle. And a lot of the time, especially for ADHD, people may grow out of it. Why? Because how ADHD works in the brain is such that with time and brain development, natural development, the problem can subside because the frontal part of the brain where ADHD occurs is the last place to develop, and it develops after adolescence, like between 18 to 20 years before it has fully developed. So when the child already has that deficit and he's still developing, with time, when the natural development is still ongoing, they may have less of the challenges they were having as children. But there are others who will grow up with their ADHD as well, and you find traits of it and how it's affecting their lives, especially when they did not get any intervention or they did not get any management. So yes, it's the question doesn't have a one direct answer. For some, you can actually grow out of it, and for some, you will have to still be managing it. For some, with development, things will get better, and then maybe for some, you may probably not see anything about it, and it all depends on the kind of disorder and also the interventions you have gotten that has helped you to overcome those challenges that you had. Yeah.
Yeah, thank you very much. So this is very typical when you talk